Hi everyone, and welcome back to my channel. And today we're going to be talking about interviews some more. I just published a video about my tips for prepping for your interviews. This video is going to be more specific to my MD-PhD applicants, and we're going to be talking about the MD-PhD interview. But a lot of the tips that I shared in the med school interview advice video is going to be applicable to this one as well. So if you want, check that out first or check that out later after this video. In this video, I'm going to primarily be talking about two different things. The first being how the MD-PhD interview differs from the MD-only interview, and the second being how to talk about research in your MD-PhD interviews. So first, let's talk about the format. It is school dependent, but usually it is just a mix of the MD interview and the PhD interview for that school. My personal experience is that typically I would have one or two MD focused interviews. So these are interviews with clinical faculty, and these are the same interviews that the MD applicants are getting as well. But on top of that, I also had research interviews with research faculty in the PhD department of my choice. All the school I interviewed at, I think, gave me the option to choose what research faculty I wanted to interview with. I do remember feeling really lucky because I feel like I built really good rapport with all of my interviewers, so much so that one of my interviewers back from when I was applying to MD-PhD programs is my current PhD thesis advisor. I will say the main difference between MD interviews and MD-PhD interviews is that research component. Like if you really think about it, I had like 5 or 6 interviews. Typically, 1 or 2 of them would be clinical interviews, and the rest would be research interviews. So more than half of my interviews were research oriented. But even though the main focus for MD-PhD interviews is more on the research, I think a lot of the advice I gave in my other video about preparing for your med school interviews will still hold. Like still do the mock interviews, still prepare for the common questions that you might get in an MD interview. The tricky thing though about MD-PhD interviews is that you kind of have to do well on both ends of the spectrum. So you have to do well on your MD interviews, interact well with the clinical faculty, and know your why for going to medicine. But you also have to do well in talking about your research, what you did, the implications of your research, and potentially to someone who may not know that much about your research. Another difference is that there's a couple different more questions that you might want to prepare prior to going into your MD-PhD interview. So obviously you want to know your elevator pitch when they ask you, tell me about yourself. You want to know why you want to be a doctor. You also want to be able to answer questions about how you envision your future career. So like, for example, what type of research you want to do, what your clinical and research split is going to be, which, by the way, that's a whole other conversation because I feel like the standard accepted answer is 80-20, 80 towards research. I don't think that is the only answer that would work. Like, for example, let's say you envision yourself being a surgeon. It doesn't really make that much sense to say 80-20. In that case, you would want to push your clinical percentage up because you actually need to do surgery. Whereas if you know you want to be a pathologist, then I feel like it's way more acceptable to even say 90-10 and 90 towards research. And of course, any answer you give, like you have to give a justification, like why you feel that way, what you plan to do at that time, etc., etc. However, just a piece of advice, if you answer more than 50% clinical, like if you're like, I want 80% clinical and 20% research, your interviewers may think that is not a strong enough justification for you to get both degrees. So you kind of want to keep that in mind. Maybe run this answer by a mentor if you don't want to go the traditional 80-20 route. Another question that I frequently got asked is, how do you think you'll manage the challenges of such a long program? Or what do you think will be your greatest challenge in such a long program? And I think with this question, they're just trying to gauge, hey, like this is a really big commitment. Like, are you actually ready for it? And with all of these questions, right, I don't really think there is a right answer. You just have to say something and justify it with your own experiences. Now let's talk a little bit about research. So at this point of the application cycle, you've probably written about your research a billion times. You wrote it on your significant research essay. You wrote it probably part of your activities. You've probably written scientifically as well for abstracts, papers, whatever. I find that the advice I give about how to talk about your research during interviews is pretty similar to the advice I give about how to write about research. And I think what's different about talking about research, communicating about your research to someone who knows the ins and outs of your field and your work, such as someone like your PI, versus someone who's on an admissions committee or someone who's just interviewing you, is that you are actually not sure that the interviewer knows the ins and outs of your field. Similarly, for your applications, for example, you don't really know who's going to be reading that. So you want to make sure like whatever you're saying makes sense to someone who doesn't know what you do day in, day out. And so this is my checklist of things that you should hit on when you're giving someone an overview of your research. So number 1, start off with your research question and tell us a little bit about why we should care. Like, is this a disease that affects a ton of people? Is this a disease where we don't really know what the mechanism is and your project is about figuring out or one step towards figuring out what the mechanism is? 2, tell us what you hypothesized. 3, Tell us what you actually did to figure out if your hypothesis is true. And finally, what did you learn? What was your conclusion? Why does it matter? I think the why does it matter piece of it is the key to talking about research when you're talking to someone who may not know as much about your field. And if they know really nothing about the field, then the why does it matter or the relevance piece of it is going to be the thing that they hold on to. So let me give you guys an example with some research that I'm currently working on, and we'll go through the checklist together, and I'll try to put some helpful visuals on the screen as well. So my project is on type 2 diabetes and the heterogeneity of treatment effect. What that means is just that there's a ton of different drugs in the market for diabetes, and how do we know that the effect of each drug and the safety profile of each drug is the same across all the patient demographics and all of the different pre-existing comorbidities that patients could have? So we basically hypothesized that the safety profiles of these drugs would be different based on patient demographics like age and sex, and comorbidities like obesity, hypertension, hyperlipidemia, etc. We did drug-drug comparisons of different subgroups. So for example, we would compare like metformin to GLP-1. We would do that comparison for males, for example, and then do that comparison for females and see if there's a difference in that effect estimate. And in fact, we did find potential signals for heterogeneity of treatment effect. So for example, we found that females have a lower risk of heart failure hospitalization if they take metformin instead of a DPP-4. And this difference between metformin and DPP-4 for heart failure was not seen for males. We found a bunch of these subgroup differences within our study. And so this is a preliminary study, a hypothesis generating study, and it just shows that there's a lot of potential for personalized diabetes medicine, and that yes, physicians do take into account, all these different comorbidities and demographics when they're prescribing medication, but potentially there is even more to be discovered in the area of personalized treatment for diabetes medications. So that would be kind of my quick blurb if I were to try to describe this to an interviewer, and they might stop me and ask me questions, but it kind of gives it a good jumping off place. It is still quite vague, as you can tell, like what exactly is the method that you used. That brings me to my next point, which is to know your research and know your methods in and out, because you're going to give them this brief overview, and if the researcher really knows your field, then they might ask, oh, what is it that you use to measure the difference between the subgroups? Like, tell me more about your method. And then you're able to talk more about it. I do it this way and kind of keep the main description of it vague-ish, because if the researcher knows a lot about your field, they're definitely going to ask about it. And if they don't know that much about your field, they're perfectly okay with kind of you describing what the relevance of it is and what you did. Okay, if you take nothing away from this section, it's just to know your research, be able to describe it in a succinct way, but also know your methods, know your strength, know your limitations. They might ask about it, they might not, but if it comes up, you have to be able to answer to it. But that said, you don't need to say all of the details right away. It's okay to kind of give a brief overview and see where the interviewer takes it. Next on my notes, we've got research talks. So some schools will ask you to do like a chalk talk, a presentation. I personally did not really get to do that. I had to submit kind of a recorded research talk to one of my schools, but it wasn't live. My recommendation for this is to practice, practice, practice. If you have a good relationship with your mentor, your PI, or even just like a PhD student in your lab, ask them for feedback on your presentation. At the very least, even if they're not able to give you feedback, at least you've put yourself in that situation where you've gotten a chance to practice, feel the nerves, all of that stuff. And again, like my advice with talking about your research to an interviewer, I would gear this presentation towards someone who has a good background in science, but not necessarily someone who knows your field of study in science in and out. Like, we get to this point when we're doing research where we're just like, oh yeah, of course everyone knows this, of course everyone knows that. Guys, no, they don't. When I was in my gap year, I was doing my project on delayed cerebral ischemia, which is a secondary complication after subarachnoid hemorrhage, which is a type of stroke. I was really going around being like, yeah, everyone definitely knows what delayed cerebral ischemia is. Everyone definitely knows this. Everyone definitely knows that. And my PI was basically like, no, Cindy, every time you talk about it in your interviews, you should clarify what it is. So just to make sure everyone's like on the same page. And lastly, I'm gonna talk a little bit about how much you should actually know about your interviewer's research. I've seen this question come up a couple times on different MD-PhD and premed forums. And the answer to how much you should know about the PI's research, it kind of depends. Like, I think the expectation that you should know a little bit more is higher if you are able to pick your own interviewer. Now, if they're just randomly assigning you an interviewer and then they're not giving you that much time in advance to like read up on them, then I think the expectation of knowing a lot about their research is less. But if they let you choose the faculty, and this is my tip for you guys, it is in your best interest to pick someone with a field that is at least in your ballpark of things you're familiar with. I know students who like potentially are considering completely pivoting their PhD field once they get into MD-PhD, which is fine. Like, you are allowed to change your mind at any time during research. I know a lot of us are pretty set in the field that we started off in, and other people not so much, like they want to switch. But I just don't think the interview portion is the best time to make that switch. Like, do it when you do second look, right? Like after you've been accepted, then talk to some interesting professors and ask them more about their research. But for the interview portion, I really would recommend people to kind of pick professors within the wheelhouse of what they already do and what they know. One time, I think a student was telling me they want to pivot their research direction into engineering, but like on their resume, they really haven't done any engineering at all. If you purposely chose a PI where you've had literally no experience or knowledge in their research area, then that's going to be really difficult trying to understand their papers and trying to have like a good productive conversation with them, especially since in a way you're also trying to like impress them, so to speak. And so it's almost like you're not speaking the same language. But that's a slight tangent. How much should you actually know about the PI's research? If they have a lab website, look at their lab website, look at their Google Scholar, look at the couple most recent papers. I wouldn't really go in depth and stress myself out about reading every single little detail about these papers. I would probably read the abstract, maybe the introduction and the conclusion, get a sense of like thematically what they do in their lab, and then I would feel good about that. In my experience, no one ever quizzed me about their lab work. However, I think people did appreciate it when I brought up specific things about their lab. So for example, I might be like, hey, I saw that your lab does a lot of work in blank. I'm also interested in blah, blah, blah. Can you tell me more? Something to that effect. It gives them more of a sense too that you might be genuinely interested in their work and maybe you can contribute to their lab. And so I just found that it's good to have that sort of conversation started, and also it gives you more information about their lab as well. Now, if you don't get to pick your own faculty members, it is still good to read a little bit about them. I think this advice still holds. You might just have less time to be able to do this prep. And that brings us to the end of this video. Thank you so much for watching. I hope you found this video to be helpful in some way. And if you did, please give this video a thumbs up and subscribe down below for more videos like this. I can never say that. There's like a blooper reel of me just saying more videos like this, more videos like this. Subscribe to the channel down below for more videos like this. On that note, please check out the medical school interview tip video that I hopefully have posted by this point. There will be more helpful information there. Let me know if you have any questions down below, and I'll see you in the next one. Bye!